Good evening, everybody, and welcome to this evening's Housing, Health and Environment OSP. As we have some members in the room who are not familiar with the evacuation procedure, I should just read through that quickly. A fire drill is not expected, so if the alarm sounds, please evacuate the building quickly and calmly. Please use the stairs and do not use the lifts. Once out of the building, please gather outside the Virgin Money building, formerly the Yorkshire Bank, on the opposite side of the road. Exit by the door which you entered the room, or by the fire exits which are clearly indicated by the standard green fire exit signs. If you need any assistance in evacuating the building, please make yourself known to a member of staff. This meeting is being live streamed on YouTube and will be available to view later on the Council's website. Can I please ask that everybody turns your mobile phone off or puts it on silent for the duration of the meeting? Moving on to item number 2, apologies. I'm aware of an apology from Councillor Sargent and Councillor Harbison. Councillor Harbison is being substituted by Councillor Kennell. Are you aware, and do we have any more? Moving on to item number 3, is everybody in agreement with the minutes of the last meeting so I can sign them off? Councillor Shepherd.
Thank you, Chair. In regard to the minutes, I did ask several questions. I was promised written responses and I have had absolutely nothing. So it is in terms of, let me just find the pages for it. The question was to the portfolio holder for health and environment, who said he'd ask an officer to answer my question, send me a response in regard to payment to Glendale on results and the savings. So I haven't had that. And I also haven't received questions in regard to monies that were allocated wrongly in a budget, and I will be told what actually they came under. So that is on page 19 near the bottom. So I've had no thing. It does say that the portfolio, that the relevant director, officer or portfolio would be sent out in, an answer would be sent out in due course. Now, it's 2 months ago, so due course is a little long, I would suggest.
Can we get those chased up, please, Victoria? Are you happy to sign the minutes if we chase those up? Moving on to item number 4. Does any member have any interest that they wish to declare which are not listed in the agenda? Moving on to item number 6. Questions to Cabinet. Does anybody have any questions to the portfolio holders? Councillor Beetham.
Brilliant, thank you, Chair. Is the portfolio holder aware of grants and help in regards to tree planting that is available from Warwickshire County Council? If so, is the portfolio holder's team working with county officers and his equivalent at county to get the right trees in the right places in our borough?
Thank you. Yes, we are fully aware of the various grants that are available for the trees. We are looking at this present time of where we can plant the trees, and the tree officer is also looking at the relevant species. I have tasked an officer to look at the green space is for planting the trees, and we have liaised with them at the county. Thank you.
Do we have any further questions? Councillor Brown.
Thank you, Chair. To begin with, I'd just like to thank the portfolio holder for arranging for the new benches to be finally fitted at the park in Ash Green and St Giles, which were damaged several years ago and have been lobbying for them to be done for some time. We've finally got them in, so thank you. But secondly, as he's probably aware, residents of in Kersley have asked for some new play equipment to go at the park there. Can you give us an update about what's happening with it, please?
Thank you. Yes, it did take me a little while to find the benches, but we got there and we fitted you 2 new black metal benches. Yes, we are looking for a piece of equipment to go into Kersley. The order has been placed and it will be going in the next couple of months.
Councillor Shepherd.
Thank you, Chair. In relation to the comment from the portfolio when he attended this meeting last time in regard to Wenbrook Meadows, which still hasn't been cut, so be grateful for an update on that. And if it's not going to be cut this year now because it's too late, whether he could let me know what savings has been accrued from there as well. Thank you, Chair.
Thank you for the question. I will bring the question that you've asked me up with the Parks Manager when I have my weekly meeting, which will be Wednesday next week.
Any further questions? Moving on then to item number 7 on the agenda, neurodevelopmental services update. And we have a presentation on behalf of CWT and Warwickshire County Council.
Thank you, Chair. I'm presenting a paper that was originally written by Sam Davis, who's the General Manager at CWPT this evening. This outlines the current waiting list position and hopefully will start to give a level of assurance that we are working towards losing and moving those weights as we go forward in the future. So page 18 of your bundle has the briefing paper from Sam that identifies the weights across Nuneaton and Bedworth. Nobody is going to sit here and defend those weights. We shouldn't have those weights, but we are in the position that we are at the moment. What we have done is look at, in the first instance, the demand and the capacity around that service. So across Coventry and Warwickshire, the clinical commission capacity is less than 50% of what is required. So to put that into a ballpark figure, we would probably have a clinical commission capacity to deliver approximately 60 to 64 assessments per month. What we're actually getting is between 135 and 140 referrals. So you can see how those waiting times have started to accrue quite quickly. CWPT is one of the providers, because we're not the sole provider for neurodevelopmental services, has been working with our CCGs, particularly the Warwickshire CCG, and both contracting departments to look at how we can model and commission an appropriate service to be able to meet the capacity versus the demand that we actually have. We commenced working with the CCG probably back in September, October to design a robust business case. We'd already looked at the all-age autism strategy as a part of that. This was for us to then pull together what we thought was clinically viable across Coventry and Warwickshire from our perspective as the CWPT provider, and then request that our commissioning colleagues take a business case for recurrent funding to their commissioning board. That paper was submitted to their board back in December, and the CCG governing body we're pending approval for the funding for those posts and for the new business case to be confirmed to us. In the interim, because everyone is justifiably very concerned around the weights that we have for ASD assessments in particular, both preschool, school age and adult individuals, both CWPT and the CCG put some non-recurrent investment into the service so that we could start to look at increasing clinical capacity as quickly as we possibly could. Some of that investment has gone into fixed-term contracts within CWPT for clinical posts. Some of that investment has gone to external providers who offer a range of assessment and subsequent treatment and or interventions following this. So from an internal perspective, our recruitment has commenced. We're starting to get people into post very slowly. You're looking probably at a lead-in time of between 3 to 4 months for that recruitment to take place. But we need to bear in mind that there's a national shortage of appropriately qualified clinicians for this specialism. So a lot of people are needing to be recruited and then trained to be able to deliver the services that we require across Coventry and Warwickshire. Internally, whilst we've been doing that within a CWPT framework, we've done an awful lot of training packages. So we've looked at training packages for our colleagues in education. We've looked at training packages for our medical colleagues within CWPT and wider organisations, our primary care colleagues, GPs, so that we've got as many people cited on the autism strategy and being able to manage that diagnosis as we possibly can. The CCG, and I can't speak on their behalf, so I apologise for that, but they, I know, have got market engagements for additional external providers and resource, and that's a CCG-led piece of work. You'll see from Sam's paper that we have modelled a trajectory over 2 years for us to get down to the 13-week NICE approved waiting time for ASD assessments. In an ideal world, we wouldn't want anyone waiting 13 weeks, but that is something that we're aspiring to achieve. There is going to be a number of task and finish groups in relation to that. It's not just about the clinical assessment. So we've mobilised a project team within CWPT working alongside our CCG colleagues around cleansing of waiting lists, training packages, as I've mentioned, triage function, and the training and engagement of our external partners. The 2-year recovery plan has been modelled on something that we hope is realistic. And again, I acknowledge that we wouldn't want anyone on a waiting list for a diagnosis, but to be able to get the number of personnel into place to make sure those diagnoses are appropriate and clinically sound is going to take a little bit of time to do that. It's dependent, as I said at the beginning of the paper, Chair, on recurrent funding being agreed across the system. Thank you.
We have a public speaker now. Julie, you have 3 minutes.
Dear Committee, I am a mum of a 10-year-old boy who over the last 4 years has had difficulties and has not attended school due to heightened anxiety since May 2021. The GP referred my son to CAMS in May 2020 and after completing 2 dimensions reports, a RISE course for children with fear and anxiety, attended several other parent-led courses recommended to me. I am no further forward with CAMS and my child is extremely withdrawn and almost agoraphobic. I believe that my son was on the ASD waiting list after a phone call with a neuroconsultant in June 2021. I was informed by CAMS a couple of weeks ago that my son was not actually on the ASD waiting list, with no reasonable explanation. Prior to being told this, both our family support worker and the school had informed by CAMS that he was on the waiting list. Nearly 2 years on from his original referral and no one from CAMS has seen my child face to face. There are implications for the families dealing with non-typical behaviours whilst they are waiting to be seen by CAMS. Children have extreme anxiety due to attending school, which shows in escalated behaviour, such as hitting, kicking, screaming and telling you that they hate their life. My child breaks down and sobs not to make him go to school as it makes his life so bad, but can't put into words why he physically can't go. Parents are experiencing financial difficulties by being fined for high absences or, like myself, have had to stop working to care for my child. You can't lead a normal life and have difficulties going out as a family, so then siblings and friendships suffer too. Mental exhaustion from having to make endless phone calls to organisations trying to gain support for your child. Reintegration into school requires consistent daily support from the parent and school by taking small steps. Schools do not have the funding or resources for the one-to-one support required. My son is awaiting CBT therapy from CAMS, which seems such a long way off, and no estimation of time can be given. An ASD assessment is at least 3 years wait. That's 5 years of wasted time. What is he supposed to do in the meantime? We have no improvement on my son attending school, and I have just received the educational psychologist report with guidelines of how to, but without the school having these resources, how will this happen? I need to apply for an educational healthcare plan, which will take at least 20 weeks, and most do not get accepted first time and have to go to appeal. In 30 weeks, my son is due to start secondary school, and without any kind of diagnosis or idea how to deal with his difficulties or an educational healthcare plan, how will he receive the support required in a mainstream school? I find CAMS unorganised and feel as if I'm being passed from one department or organisation to another. The doctors won't prescribe my son any medication as he's already referred to CAMS. CAMS tell you they can't give medication until he's been assessed. Alternatively, you can ring the crisis team who tell you to look on the RISE website for help, or if your child takes matters into their own hands and hurts themselves, you can take them to A&E where you will be seen by the mental health team within days. So basically, the only way you can be seen quickly is if your child tries to take their own life. How is that prevention? There needs to be a procedure where the parents know exactly what is going to happen from start to finish. A triage system where the child has a face-to-face assessment before assumptions are made regarding the child's mental health before treatment or further psychological assessments are recommended.
Do you like to come back with any of those points?
First and foremost, I'm very sorry for your son's difficulties. I am not passing the book, and I'm happy to take your details, but CAMS is not part of my area of sphere of work. However, my colleagues do work within those services, so at the very least we should be able to get you an answer as to where your son is on that waiting list, and what the expectations are going forward. I'm happy to have that conversation with you.
Any members have any questions? Councillor Brown.
Thank you. I'd like to thank you for the presentation to begin with, because it builds on what is actually quite a thin document here with information. But you've said in your presentation that the plan to get the waiting time down to 13 weeks is realistic. How has that been tested to make sure that it is realistic and not just a finger in the wind type projection?
Thank you for your question. So the demand and capacity has been modelled fully across the system with our CCG colleagues, with us as a healthcare provider and with other providers. We've looked at the workforce and the workforce planning. We've looked at capacity in relation to how many assessments are realistic to deliver, factoring in an assumptive period that people may be off sick, or whether or not, again, as you alluded, we're not doing an awful lot of face-to-face work where we would have perhaps done that before, but we haven't been able to because of a number of the COVID restrictions. So we've tried to factor in over that 2-year period as almost a not quite worst-case scenario, but something that we feel is realistic and achievable. If we surpass that, then that's excellent because people will be getting their diagnosis more quickly. Sorry, does that answer your question, sir?
Through you, Chair. So the testing's been internal rather than benchmarked against external best in practice.
There is no national benchmark to be able to do this against. So this is yes, it's been done across our system. So it's not just internal to healthcare. We've been looking at this as part of the written statement of action with education colleagues, with social care and local authority colleagues. So it's been looked at across the system. It's not just in a silo of health only.
Thank you again, through you, Chair. Thank you for coming back to me, because I didn't realise there was not a national standard, if you like. I take it you have interim milestones.
The mobilisation plan and the trajectory has got interim milestones. The milestones are looking at when we bring the additional clinical assessment capacity on board, where our external providers feel that they can offer additional assessment capacity, and we've modelled that against the increase in the capacity with an assumption that the demand remains the same. We can't assume that the demand will fall or the demand will rise, so we've gone with what the demand currently is. It's worth noting across Coventry and particularly Warwickshire, the demand for autism assessments is significantly higher than most other areas within the country. So whereas most of the other areas are between a 1 and 2%, Warwickshire is approximately 4% of the local population. So I think that's one of the motivating factors, and quite rightly so, that we're looking at additional recurrent investment into autism and autism pathways across the system.
Any other members of the question? Councillor Shepherd.
Thank you, Chair. I was with others, one of the people that asked for this to come back to this panel, but I'm a little disappointed again. I was expecting certainly a bigger document than this. I thought we had asked for other information in regards to what is getting done, not just figures that looks like actually nothing's getting done in this borough in terms of supporting young people. 714 cases, I mean, they've waited all that time. The lady has said herself, her son is now due to go to senior school. He's lost 4 years of education already, so how he will cope in senior school, I'm just not quite sure. There's some details in here in terms of the 2-year plan that you've put into place, and apologies for me back, it's just where I've sat tonight. You've said 2 years and you'll hope to get it down to 13, so how are you going to get this list down? Because if you worked on the 4-year one and got that down a little bit, and the 3 years, then those that are on 52 weeks will slip again into 3 years, so I'm just a little unsure how you're going to manage to do that. And the other thing is, if you don't get the funding, what's going to happen? Thank you, Chair.
We come back.
I can just reiterate that the modelling that we've undertaken with our system colleagues, it's not in isolation for Coventry Warwickshire Partnership Trust, takes into consideration other providers, takes into consideration the numbers that we feel would be able to staff and recruit. The response to the second part of your question, Councillor Shepherd, what happens if we don't get the funding? Then we cannot increase the clinical capacity that we have currently. We need the system funding to be able to do that.
Councillor Beetham.
Brilliant, thank you. In regards to the trajectory, all we have here is that 2024, no one will be waiting more than 13 weeks for an autism assessment. And you said that there are goals along the way. Do you have any of those goals with you today you can share with us? Because the paper is very light on having those dates as benchmarks.
No, unfortunately I don't, because I was anticipating that one of my CCG colleagues would be in the room this evening with that information for you. So apologies that hasn't followed through, but we can get it to yourself, Chair, if that would be helpful.
Yeah, if you could make sure that we get the goals so we can have a look at what we're working towards, then I'll share that out. Do you want to come back, Brett?
Would I be able to ask, much like there is it for the Nuneaton Bedworth details, that the projection is also targeted that way for Nuneaton and Bedworth, if we're able to get that data? Because I know down in the bottom it says that there's new regular reporting. And can we also have it against what is expected or projected for Coventry and Warwickshire as a whole, if that's a possibility?
I'm actually going to refer you to my colleague on the end as to whether or not that would be appropriate to share that data in its fullest format. It's outside of my sphere of knowledge, I'm afraid. We'd need to have a conversation with our contracting and informatics colleagues and come back to you with a response.
If you could come back as quickly as possible. Councillor Brown.
Thank you, Chair. Just want to build on something you mentioned in your earlier answer about the differences in demand, if you like, or where you mentioned it was higher in this area than other areas. Do you think you can give us some more information, perhaps flesh out what the reasons or the root causes of that might be.
We genuinely don't know at this moment in time. We've certainly worked with a number of colleagues to try and ascertain why the referral rate in this area is significantly higher than other parts of the country, but I couldn't give you a cast iron answer as to why that is at this moment.
Councillor Beetham.
Brilliant. Just carrying based on that topic of conversation, in regards to the referrals, I can get that we've got more, but do we know as a percentage of population of those with or who have had official assessments for autism where we are at compared nationally? Because it could be that, let's say, we have a lower percentage of those who have been officially diagnosed, yet the referrals have increased because people want that official. Thank you.
So for the referrals that we get into the system, it's approximately between 135 and 140 a month, across Coventry and Warwickshire. Of those, approximately 80% end up with a diagnosis of some description. It may not be ASD, it may be ADHD, it may be another neurodiverse diagnosis. Sorry, sir, what was the other half of your question?
So my other half was of those, let's say, already assessed, so have gone through the referral, how much of the population of Coventry and Warwickshire, for example, have had that kind of autistic spectrum disorder as a diagnosis? So let's say it's 5%, whereas let's say nationwide they might have like an 8% on average, if that makes sense. So could that explain the difference of referrals now that perhaps Coventry and Warwickshire are finally catching up on diagnosis, if that makes sense?
So most areas of the country would clinically commission capacity for a maximum of 2% of the local population. The numbers that we appear to be getting are between 3 and 4. It does fluctuate. So it does look as though across Coventry and Warwickshire we have a higher proportion of people both being referred and then ultimately being assessed and diagnosed.
Councillor Shepherd.
Thank you, Chair. When we had this last meeting, there was figures there for Rugby and the other districts, and Nuneaton and Bedworth weren't there, which is why we asked for them. It now shows why they weren't there, because of the high numbers we've got in this borough compared to the other districts, and the other districts are fairly low. So I am worried about the resource element going into this borough to get the figures down than other districts. So with that in mind, Chair, I am going to ask that this is referred to Cabinet to look at, to work with the partners and the portfolio of Warwickshire County Council, because I think something has gone badly wrong for this authority, and we are letting the children of the borough down badly. Obviously, I would hope that there'll be a second.
Do we have a seconder?
Could I just ask, Chair, would you mind if we could just clarify that I've heard the question you've asked, Councillor Shepherd. You wish to know whether Nuneaton and Bedworth is getting the proportionate amount of the resource that's being invested in Warwickshire. Is that the question you just asked? I can't answer that question, but I want to.
When we had the figures from the last time, it would show that the resources aren't actually coming our way.
Okay. Okay, so having understood the question, we can go away and see if that we'd have to ask our CCG and local authority colleagues to answer that question, because they're obviously the commissioning bodies.
If you could go away and come back to us with an answer on that, it would be very helpful. Do we have any other questions? No. I just have one question that I'd like to ask. Looking at the wait times, where is the focus going to be on getting some of these down? Because some of the figures around 1 to 3 years, if you look at the whole picture, where are we going to focus to get these down?
So across the system, there are a number of working groups. All of those have either EBE, experts by experience, people with lived experience, or parent carer voice on those groups. So we are working with those individuals to look at a priority list, because you're absolutely right, we cannot just go in potentially date order if the priority is a school-aged child needs a diagnosis more quickly to support their education. So we're being guided by our local population as to the order of priority in tackling those weights.
And would we have information on where that priority is for Nuneaton and Bedworth?
I haven't got that, but I can find out.
Does anybody else have any questions? If we have no more questions, I'd like to propose a recommendation that, with the committee's approval, that we bring this back in 12 months' time so we can see where we are with the targets towards the 2024 figure, and with a briefing note brought to us in 6 months so we can have an update in 6 months to see where we are. Do we have a seconder? Councillor Brown? If we take a vote, is everybody in favour of that? That's carried. Thank you very much for your time this evening. We'll just give everybody a minute to leave the room. Moving on to item number 8 on the agenda, Healthwatch Warwickshire, and a report from Chris Brain.
Thank you, Chair. My colleague Poonam Thompson did submit a short report which she identified the main issues that have come through to us via email, the telephone, the website, social media, and our interaction with partners. So I won't actually go through that and read the paper out to you, Chair, you'll be pleased to hear. What I will do is add a little bit of context, because things are moving so quickly that by the time you write a paper like this, it's almost out of date. So I did want to just touch on 1 or 2 things that have occurred since the paper was written just a week ago. GP access remains one of the major issues for us. And I think it's still part of the lack of face-to-face appointments that people have, and people are still saying that they don't feel as assured by a telephone conversation or a Zoom-based conversation as they did through face-to-face. So, and people are asking us fairly regularly, when are we going to restore face-to-face appointments? And at the moment, we're still trying to clarify that with general practice. The other part of primary care that's causing particular issues is dentistry, NHS dentistry. And there are some parts in Warwickshire, such as Rugby and Stratford, where there is no NHS dentistry available. And it is a position that across the county appears to be deteriorating. We wrote a report on dentistry back in April and May of last year, and we will be repeating that in April of May this year. And what we did was to ring every dental practice in Warwickshire to ask them what the position was regarding NHS dentistry, and whether they were losing dentists, and whether they were intending to continue in NHS dentistry. And since then, the British Dental Association have issued a report about NHS dentistry. And that has caused us quite a bit of concern, because they're saying that 1 in 10 of their members intends to leave NHS dentistry. So we're going to have a much closer look this time in April and May, and one of the areas we will be looking at is Nuneaton and Bedworth, because it was an area where we got the lowest response from dental practices. So we will be doing that, and if it's all right, Chair, I will, when we've completed that survey and done the report, I will send it to you, so that members can have a look. In the meantime, if people do report some issues with NHS dentistry, if they could just let us know, that would be great, because we'd like to hear what's going on. A couple of other things that are changing. The Care Quality Commission is the organisation that inspects and regulates health and social care services in England. And they have been, as we have, working on a virtual basis now since March of 2020. But they are now going to revert back to face-to-face visits on from the 1st of February. And they'll be doing those based on a risk assessment of, because what they did previously was to do routine visits to care homes, to dental practices, to hospitals. Well, they're now going to be doing that based on risk. And they're also carrying out what are being called infection prevention and control inspections. And I will be interested to hear how those are happening across Warwickshire and how effective those have been. A couple of last very quick points, if I may, Chair. I was very taken with the story that we heard about autism. And one of the projects that we are in the process of developing is around learning disabilities and autism. And in particular, the issue of what's known as a reasonable adjustment by people who provide services. And it looks as though that's an area of work that's underdeveloped. So we are going to be looking, and this is fair warning to all providers, we're going to be looking very closely at what reasonable adjustments are being made to cater for the needs of people with learning disabilities and autism. One more, in fact two more if I may. People with deafness and hearing loss, we are looking at the way in which people with deafness and hearing loss can have their rights met within the NHS Constitution. And what we're hearing from talking to partners, from talking to people with hearing impairment, is that there is a chronic shortage of BSL interpreters, British Sign Language interpreters. And that is apparently beginning to mean that people with hearing loss are not accessing services because they are finding it too difficult. Now, we're going to be doing a bit of work to build that up and to find out what the real picture is. But the initial finding we have is that appears to be a little bit of a problem. And the final area I want to touch on, and then I'm happy to take any questions, Chair, is about LGBTQ plus people who are saying that they are finding it difficult to access, in particular primary care. And they are reluctant to do so because they have a perception about how their needs will be met. Now, there is a real basis to those perceptions. Gender reassignment clinics, the waiting list for a gender reassignment clinic is 43 months. And that's 43 months people have to live in crisis of identity. So that is something that we're beginning to pick up. We have talked to our colleagues about in Coventry and Warwickshire Partnership Trust about this. And we hope that we can have a much more comprehensive approach to the needs of that group of people. So with that, Chair, those are the main ones. There are others in the paper, and I'm happy to take questions on any of them.
Thank you, Chris. Does anybody have any questions? Councillor Downs.
Thank you, Chair. Good evening. A couple of things. I mean, I've just noticed then, it's just more of a statement than a question. It seems to me, by what you've just said, you can actually get your gender reassigned quicker than you can get a diagnosis in this county. That's for mental health. That's ridiculous to me. That's what I've just heard. Correct me if I'm wrong. Also, with you mentioned the GPs doing face-to-face again. Now, I'm just a man in the street. I'm nothing special, but everyone's talking about, the general public are saying, well, it's crazy because all the GPs are out giving jabs for £100 a shot, and we can't see a GP. So, one, is there any fact to that? Yeah. And two, when do you think we're going to be able to see a GP? Because for 2 years now, no one's seen anyone. So, thank you very much.
You'll understand I'm a little bit reluctant to answer on behalf of GPs because they get a bit prickly when you do that. But to me, I have some sympathy with people who are saying that a number of other areas of health and social care are opening up. Care homes are now having visitors. They are. You know, we haven't stopped going to acute hospitals because of COVID, and we've moved on from the blue bed and green bed corridors that we had previously. So it is becoming harder and harder to understand why that isn't happening. Now, the GPs will say that they are overwhelmed with demand. And we have to be fair about this. People have been locked down for 2 years, and their physical and mental health has suffered as a consequence of that lockdown. So not only are people presenting a bit later than they were previously, their conditions are much more complex when they do present. And so the demands on both on primary care and on secondary care and on our colleagues at mental health have increased significantly over the course of this pandemic. Having said all of that, I'm agreeing with you. I think it's about time they started to see people face to face and to give them the reassurance. Surely that is better than having people continuing to be anxious because they can't see a GP face to face. It's surely better for them in the longer run. And in terms of the waiting times for things, part of it appears, I'm no expert on this, you know, our colleagues have gone, part of it appears to be the availability of qualified clinicians doing that area of work. There is a real workforce crisis in health and social care across the piece. We are short of doctors, we are short of nurses, we are short of therapists, we are short of consultants, we're short of social care workers, because people are not willing to take those jobs on. And, you know, whatever that reason is, whether it's pay, and I don't think it is pay, whatever that reason is, it's something that the NHS and social care has to tackle between them, because if they don't, we will continue with these waiting lists ad infinitum. They did introduce something, you know, Chair, called the Accelerator Program. And what that said was that we were going to provide services such as diagnostics at 125% of capacity. And if you did that, you'd reduce the waiting lists, because they'd be diagnosing more than they usually do. Unfortunately, if you haven't got the staff, you can have as many accelerator programs as you like. The waiting list will not go down, and I think that's currently where we are at the moment. The waiting lists have come down in some disciplines. Our performance as a region in terms of cancer has improved significantly in the last year. And we've seen it in terms of people getting their appointments, referral to treatment times and all that have improved. But there are other areas, and mental health is one, where actually that performance improvement hasn't been the same. Just hasn't been the same. And I think it needs to change very quickly. So does that actually answer your question, or have I just waffled? Oh, right, okay.
Councillor Beetham.
Brilliant, thank you, Chair. Just a quick query. Out of all the work here and all the data you have, how many responses do you tend to get in regards to just Nuneaton and Bedworth? I know you mentioned that a lot of the dentists here didn't respond, so I was wondering what the response was like from residents, how that compares to other areas as well as other organisations.
No, it's a good question, and it's a fair question, because 2 years ago we were getting virtually nothing from either North Warwickshire or Nuneaton and Bedworth. So what we did was we employed somebody, Poonam Thompson, to focus on Nuneaton and Bedworth and the North, and the position has improved significantly to the point that we now get more from Nuneaton and Bedworth than we do from the other areas of Warwickshire. And so we are beginning to get a number of inquiries and a number of problems being presented to us from this region. The bit that's really difficult, Councillor, is we can't get men to respond. If you look at the numbers from Nuneaton and Bedworth, 82% of the queries we get from Nuneaton and Bedworth are from women. 82%. So I don't know what it is about us chaps up here in the north. We don't seem able to ask these questions, do we? But there's a serious point about men's health. And mental health in particular is not being addressed because we're just not hearing from those people. And they do exist. We know they're there. So anything we can think of to encourage men to talk about the issues that they're facing, I mean, I would welcome that with open arms.
Councillor Kennan.
Thank you, Chair. Just before I come on to my main point, just back to the point on GPs, I noticed that Councillor Garby was more, well, quite frankly, hounded for saying the exact same things as yourself, so it's refreshing to hear it again. I mean, I even heard one story of a GP publicly shaming a patient in the lobby of their practice. But on to what I'd like to bring up is just the priority area on mental health. It mentions, well, specifically and only eating disorders in the report here. Has there been sort of wider trends that indicate eating disorders need that particular focus? Because I fully understand and appreciate just how destructive eating disorders are as the deadliest mental health illnesses out there. But when there are others like post-traumatic stress, personality disorders, even just major depressive episodes that are still causing great pain to a great many deal of families. But from what you just said a moment ago about women tend to be the most responsive people and eating disorders tend to affect more women than men, I'm just wondering, are there wider trends in the community in Warwickshire that are making Healthwatch focus specifically on eating disorders? Thank you.
I will be candid with you. The reason eating disorders appears there is because an organisation called Making Space approached us and said we'd like to do something around eating disorders. And that's kind of why we did it. But eating disorders are part of a wide range of anxiety-related conditions that are being presented to us. The most common mental health inquiry that we get is around loneliness and isolation. And that is probably more than half of what we get. And you're right about PTSD. People's experiences of this pandemic, especially if they've been to an acute setting and watched it, they come out of there suffering from PTSD. That's patients and staff come out of there because what they've seen during those episodes has been so traumatic. So we have loneliness and isolation. We have a whole series of anxiety-related conditions, including people who now are finding it increasingly difficult to leave the home at all and are getting very little in the way of support in their homes. And I also looked at, because I did look this up before I came out, and the third one after loneliness and isolation and anxiety-related conditions is depression, which we've come across now in increasing numbers. And I think what worries me about depression is we can see it very clearly, but it isn't being diagnosed. And so there are people walking around with what's called the black dog, the manic depression, and they haven't actually been diagnosed and they're not getting the support. So there's a whole series of mental health conditions. The only reason that eating disorders is there is because we've got a specific project with Making Space. We will be dealing with the other matters with the providers and commissioners of services.
Councillor Brown.
Thank you, Chair. In your presentation, you mentioned dentistry, but I noticed that whilst dentistry is listed as a concern, it's not a priority. Are you intending to change that?
Yeah, I first raised dentistry, NHS dentistry, as a concern back in April and May of 2020. Because I could see the trend emerging at that point. So what we've done since then, we've done some work with NHS 111, because the recommended course of action for people who can't access an NHS dentist is to ring NHS 111. So we've done a fair bit of work with them to try and say you need to be more precise in your information for people who can't access NHS dentistry. It's no good saying to them, go to an urgent treatment centre if there aren't any. So we did that initial bit of work with NHS 111, and our report is on our website. about how we did that, as is our dentistry report on the website. What was intended to happen, and Councillor Golby has taken stick because of this as well, I know, is that the commissioning for NHS dentistry was meant to be moved to the local level, to the integrated care system, in April 22. It's now been moved back to April 23, and they're not being asked to take responsibility for it. So I'm trying not to laugh at this. They're not being asked to take responsibility for it. They're asking to be ready for it in April 23. So the real problem we've got, which is why there are other things where we can make a greater impact. The real problem we've got is that everybody is denying it's their problem. They're saying we don't commission it, therefore we can't do anything about it. And it's NHS England that commissioned it. So we met with NHS England and they denied there was a problem. And they said it's better in Warwickshire than most places. Well, I hate to think what most places are like, because you can't get an NHS dentist in parts of Warwickshire at all. And when we talk to them, they say, no, we're not doing NHS appointments. You'll have to go private. So there are real issues, and it has never stopped being a priority. But for us, what we have to do, we've got so few staff, half of whom have now got COVID, by the way. So we've got so few staff that we have to prioritise where we can have the greatest impact. And that at the moment appears to be LD and autism, it appears to be mental health, and it appears to be GP access. But once we've got over those sort of humps, as it were, we're not going to let NHS dentistry go. I'm writing to the chair of the Health and Wellbeing Board about our concerns about dentistry. And just to say, keep it on your radar as a county, because this isn't going away. There are people who are in chronic dental pain who are now going to A&E to get painkillers to deal with it because there's no dentist available. Well, that can never be right. And of course, the other bit in all of this is they're missing some of the conditions that access to an NHS dentist shows up, like oral cancers, like children's health. And of course, your dental health is related to your cardiovascular health. So there are all sorts of things that are being missed now because people are not accessing those dentists. The NHS, can I just leave you with this one, Chair? This NHS England person said to me that you don't need to have your teeth checked every 6 months. She said, I've had mine checked for 2 years now and had a problem. And I thought for me, that is just not acceptable. Because all of the things that a review picks up, it's not just about whether you need a filling, it's everything else. And I think we need to get back to the point where a normal review of your dental needs is part of what we do growing up. It's part of what we do as children. And it needs to be part of our routine going forward, Chair. And it's still going to be a priority.
Do we have any more questions? Councillor Pandey.
Thank you, Chair. As you mentioned in the hearing loss in the communities, there may be language problem because of that. What are the plans, how we are going to reach those communities to sort out this problem? That's all, thank you.
And it's a good question. And we're told that the reason is there's a shortage of British Sign Language interpreters. But all of our conferences, we managed to get hold of an interpreter and they're on the screen the same time as everybody else. So if we can get hold of them, I'm struggling to understand why much bigger organisations can't. So part of what we're doing is, in terms of our deafness and hearing loss project, we'll have a quick look at it now, is that we are going to be lobbying hard to say that in not providing a BSL interpreter for these people, and one of the things people have to understand about BSL, chairs, is that because you can speak BSL does not mean you can speak English. It does not mean that. It means you can speak British Sign Language. And it's the same as any other language. so that what they've tended to do is to give them the leaflets in English, and that doesn't help if you can't speak it or can't read it. So what we're doing now is we're saying that because there are no BSL interpreters, because of that people can't access services, those people are being denied their rights under the NHS Constitution. And we're going to be pressing very hard to say you have a duty to give those people their rights under the NHS Constitution, never mind the accessible information standard. So there's all sorts of things there about that. And we're going to be pressing hard to say, if we can get hold of them, why can't you?
Councillor Pandey.
Thank you. There may be many volunteers people, they want to help these maybe all languages. So if you can raise something, list of volunteers, they try to help, then you can call them if there's any problem, or they can sort out things. Maybe that may be helpful for recruiting volunteers. It's free of charge. Thank you.
Thank you. That's a helpful suggestion. We'll follow that up.
Councillor Golby.
Thank you, Chair. I know I'm not part of the committee, but actually I am allowed to make a statement rather than ask a question, which is what I'll do now. I would like to gently encourage you to bring up those topic headers next week when our meeting with the ICS chair takes place. I think those are definitely things that need to be brought to the table, and that is the most appropriate arena to do it, direct, face-to-face. So if I could just slightly gently encourage you to write something for next week, I would greatly appreciate that, Chris.
Noted.
Do we have any more questions? Just have one quick question around mental health. You said that the reason you're focusing on eating disorders is because you've had a group come and approach you to work with them. Is there any other groups, particularly around men's mental health, that have approached you, or are you looking for groups to come to you? I know that I had a conversation with a group the other day, and they were saying that the uptake for men is not what they expected within their... So they're trying to promote what they do and get it out there. And I just wondered whether groups are approaching you to work with you, or whether they're not coming forward.
Yeah, at the moment, there are two groups that are working on men's mental health that we're in discussions with, apart from making space. One is called Men Talk, and another one is called, rather unfortunately, It Takes Balls to Talk, which I always find slightly embarrassing to repeat in polite society. But those are sort of... those have approached us, and they've struggled with the same problem. And when I looked at Healthwatch England's annual report today, there's a clear indication there that it isn't a Warwickshire problem, it's a gender problem. And somehow, I don't quite know how, we have to get to a point where any of the perceptions about stigma, and that's what it is, there is no stigma. We all admire people who come forward and actually talk about their problems. We admire them. But there is a perception that it would be seen as a sign of weakness or some other... I don't quite know what macho culture that's all about, because if I've got a problem, I'll tell everybody about it. But there are some who will simply not do that. And it's interesting, we did a cafe, and we had a room separate where men could go and talk about their mental health. And nobody used it in the morning at all. We put a screen around it so nobody could see you going in, and people started coming in. Now that, for me, I thought, well, why is that? What is it about that? And so there's something in there that we're trying to get to with Men Talk, and It Takes Balls to Talk. See if we can understand what those motivations are. What can I say?
I actually had a similar conversation with Tim from Men Talk on the phone the other day, because it's their group that they do stuff in Nuneaton, and they're trying to get men and encourage them to come forward. And it's a great way of coming forward because it's based around sport. So not only do you do a sporting activity, but also if you want to talk to somebody, there's qualified people there who will listen to you. So it's definitely worth pushing, and he's been asking me if we would do something to help them move it forward. But I think it's the old adage, we don't want to tell people how we feel, but there's no shame in telling people how you feel. And from personal experience, it took me a long time to learn that. Do we have any other questions? I'd like to thank you for coming this evening, Chris, and thank you for the report. Moving on then to item number 9, the Community and Voluntary Sector Performance Report. I'd like to introduce the officers to present it.
Many thanks, Chair. Apologies, it was a bit delayed. That was, again, sorry, due to COVID. So what you have in front of you is quite an in-depth and comprehensive report for the first 2 quarters of 2020, 2021, 22, so April through to September. So just mindful of that period because it feels like quite a long way back, which covers kind of key performance information for Warwickshire Carver, who today Alison Thompson, the locality lead, is representing and is here to take questions. And then we've also got the information pertaining to CAB, and Bill Bazra is here. So what I'll quickly do is just pick up some of the kind of most salient points, because I'm sure you've kind of gone through the report. There's a lot of detail, a lot of information in there, and then maybe organisation by organisation, if members have got questions, I'm sure Alison and Bill will pick those up. So again, that period of time, as you will see throughout the report, the pandemic has obviously had a massive impact in different ways. So particularly for Warwickshire Carver in terms of the areas of operation, the areas of support, the needs of the community and voluntary and third sector at that point were mainly kind of driven by lots of the issues happening around us. However, what you see is really quite good performance throughout that period in terms of the targets that are set of them. They've exceeded those. And you'll see where, you know, it's got, as an example, 104 groups that were worked with, 148 different projects or initiatives were supported, even through to, you know, an area that has historically been quite difficult at the best of times is recruiting organisations to take on additional volunteers, and then supporting them with the recruitment of volunteers, etc. That obviously had kind of taken quite a different direction throughout the period of the pandemic, and particularly that period. So if you think of the journey throughout the kind of 2 years that we've been in the pandemic, there's been different asks, and often when those asks have come from statutory organisations, they've kind of come into us at an Nuneaton and Bedworth level, and the kind of first point of call for us to turn to in terms of supporting community organisations, recruitment of volunteers, and coordinating that, because what we had at points was a massive activity, but it wasn't necessarily coordinated. Warwickshire Carver have kind of been instrumental in aspects around testing, around vaccination, and then more generic support, because there was other community activities still happening in a COVID-safe environment, so to speak. But if you've got any particular questions, I'm sure Alison will be able to pick those up. And also what you've got is, again, just that ability to kind of continue to support organisations to safely take on volunteers, provide opportunities, recruit and promote. And again, this period is quite a while back, and through that period, again, what you had was some very kind of, you know, challenging times where a lot of stuff obviously was being done virtually, but there was some activities that were happening face-to-face and in person. Then moving on, secondly, you've got the report and the information relating to the CAB, and again, what you see there is, you know, strong performance, and again, an organisation that had to very quickly change its approach of how it engaged customers, how it supported communities, and through that period, and again, Bill's here and he'll maybe pick out some of the kind of key points, but the different ask, but a massive volume of ask from our communities. So again, at the best of times, the call on the CAB is always quite significant. Then when we went to a period where, you know, a lot of that was done over the phone or via virtual mechanisms, they've had to adapt to that. And again, through that period, they've kind of anchored themselves in Town Hall, which has been interesting. And again, I'm sure Bill will kind of look to expand upon that. The areas of significant support for that period are not ones that will be a great surprise, which are kind of debt and this time universal credit. The areas and awards of support, again, through that period was Abbey Awards for both periods. And that has changed often when you look back through the reports, and it'll be interesting to see what that looks like for the final 2 quarters that we're in at the moment. But there are some of the most salient points I thought I'd cover and pick out from the report. And then if maybe we take it turn by turn, if you've got questions for either Alison or Bill for their respective organisations, I'm sure they'll be happy to take those. Thank you very much, Chair.
Would we like to start with questions for Carver? Do we have any questions? Councillor Shepherd.
Thank you, Chair. I'm very well aware of the way Carver does. I've worked with myself as a community organisation. In terms of on page, I don't know if you've got the document in front of you, page 27, you said unique organisation. So what, in terms of a unique organisation, what's a unique organisation? Oh.
Well, of course, all organisations are very unique. That basically means, so we're not double counting. So we wouldn't count one organisation twice in that, so it's individual organisations.
Yeah, that's okay.
Thank you. In terms of the area of benefit for each intervention, you've got Bedworth, North and West, but you've also got Nuneaton and Bedworth Borough. So I suppose my question is why is it split up in that manner? Because I'm just a little surprised.
Can't get the technology right. So we in our database, we identify all organisations when we register them into the database on their primary area of benefit. And obviously, as you know, there's lots of organisations that have a very specific ward area, but the vast majority of our organisations, particularly in Nuneaton and Bedworth, just because of the size and geography, most organisations cover the whole of the borough. So I think that's probably why that explains the split.
So in terms of the Bedworth, North and West then, are they, those figures for intervention, they covered in the Nuneaton and Bedworth borough bit? I'm just, it's just how it's split up. I'm just, because if you've got Nuneaton and Bedworth borough, I presume the figures for Bedworth, North and West are in that category at the bottom. I might be wrong.
No, they will be defined organisations who operate primarily for the benefit of Bedworth North and West, as opposed to the whole of the borough. It just depends how they've been inputted onto our database in the first instance. I would guess that's probably Friends of the Nook, if I'd put money on it.
And just one more, in terms of the funding, you've put on the cumulative totals, 131,600 applied for and only £600 given in quarter 3, or quarter 2 it'd be. So it will be useful to know why they have either, whether there's any outstanding funding bids within there, but also why they didn't get it, whether it was an issue in terms of the forms, it was oversubscribed. I know all the job, but I think it would be helpful for this committee to know why we haven't got the funding some of the groups have applied for, and was it short deadlines, and therefore it was really difficult for them to get all the information they needed to do a form in the first place.
Yes, Councillor, you're absolutely right. It's all of the above. So I can give a slightly more up-to-date figure. So across the first 3 quarters now, we've got a total applied for of 1.2 million, and actually only an awarded figure of 77,000. So that shows the massive amount of work that we're having to put into organisations, and obviously we don't have any control over an organisation's success rate. A lot of that will be around the timing of when decisions are made about grants and which quarter they fall into, so where it's reported back. But there will be lots of organisations who've applied and as you say, struggled with the form, struggled with deadlines, numerous issues that we're trying to support groups with, and we are always feeding that back. So for instance, fairly recently we've had a lot of feedback from organisations who've applied for county council funding. For example, the social impact fund is the most recent application, a massively weighty process, and we've got some really constructive feedback that we're giving back to the county on the processes that they use, their eligibility criteria, and therefore their reach, especially in groups that we know in the north predominantly struggle with making funding applications. There's not necessarily the capacity, the time to do that within organisations.
You've mentioned the impact fund. Do you think maybe the residents from this borough didn't apply because of the time scale it was given, because it was over Christmas, wasn't it? So would that have been one of the bigger issues for groups to get together to try and fill a form in?
Potentially for that one, it was a really weighty process for small and large amounts of money, and it appeared to be a similar process whether you were applying for £5,000 or £100,000. So the demands on groups are terrific, and their capacity to be able to respond in an effective manner with the weight of detail that is often needed. So for that fund, for example, there was risk assessments needed, there was business plans, there was financial forecasts, and a massive amount of groups just would really struggle with that and be put off at the first hurdle, so wouldn't apply in the first instance. So we've helped a lot of groups with not even the form filling, it was all of the project planning and finding quotes and the prep work needed just to put pen to paper.
Do we have any other questions? Do we have any? Thank you, Alison, for that. Do we have any questions for the CAB? Councillor Kennan.
Thank you, Chair. Just to turn everyone's attention to the chart on page 51 of the report. You'll see that 8.44% of the issues reported are in Barpool wards, but only 2% of your clients live in Barpool, which I think, just through looking at the chart, says the biggest discrepancy for any wards in the borough. So just wondering what work the CAB may have plans to reach out to more of the residents in Barpool to try and get to the root of these issues and help a few more people. Thank you.
From our perspective, I think, you know, we've come into Omicron. There's been a slight kind of withdrawal of services. What we're hoping to do now that we're out of that is to get our promotion of services so that people are aware across Nuneaton that the doors are open in the Nuneaton Town Hall. We're offering a 10 till 2 service on Tuesday and Thursdays. What we're also doing, recognising that for some people in Nuneaton, accessibility to town centre is a difficulty. We're also delivering outreach in certain areas, and we've commenced that from February. So we will be delivering outreach in Camp Hill. We are looking to deliver from Stockingford Children's Centre, Camp Hill Children's Centre. We're also delivering in Wembrook as well. So hopefully with a combination of outreach, a greater accessibility of our front door, we'll be able to reach those areas that currently look like they're not being reached in the performance reports.
Do we have any other questions, Councillor Shepherd?
It's more of a thank you. I'm aware of the work you've been doing in terms of virtual Teams meetings to get people so they can see a face, because sometimes on the end of a phone is particularly difficult for some of our residents. So I think bringing that in has been a real success in terms of that. In terms of moving forward, obviously we've seen the energy bills are going to be sky high this year. Obviously people are going to get themselves into some financial difficulties. Do you feel you've got the capacity moving forward to deal with some of the issues you're going to be getting? I know the prescriptions are moving from April and the over 60s have got church, so that'll put a thing on the older people. So it's your capacity to manage is I'm wondering about.
Well, it's a brave man that admits that they have the capacity. I mean, I think everybody in the room will be aware that there's likely to be an increased demand on most people's services, including CAB. There's the issue around fuel bills, cost of living. We've already seen an increase month on month over the latter part of 2021 as government support measures have been reduced, things like furlough, the moratorium on the evictions. We've seen a steady increase, particularly in terms of debt, but we expect that to increase over 2022, particularly for those families who are just about treading water at the moment, and where those increased fuel bills, inflation and so forth will actually tip those families over the edge. Do we have the capacity at the moment? I think we're in a better place than we were perhaps 2-3 years ago, particularly through the co-location within Nuneaton Town Hall. What we've found is, certainly during COVID, where most of our interview rooms, certainly in Bedworth, weren't 2 by 2 metres, let alone having windows, having access to a larger space where we can deliver face-to-face activity has been really beneficial. The links that we've made with the Borough Council through ABU, through housing officers, Revs and Bens, has meant that actually we're getting people a lot earlier now than perhaps was the case in the past. And from a capacity perspective, we are looking to do a recruitment drive for volunteers over the course of the next year. So at the moment, we have 52 volunteers across Nuneaton, Bedworth and Rugby, of whom approximately 27 are in Nuneaton and Bedworth. We think that we need at least 75 volunteers by March 2023. So that's the target that we've set. Partly it's to meet that increased demand. Partly also it's a recognition that the access channels that people are using for our service now have changed slightly. There's still a need for face-to-face delivery, and we certainly noticed that when we opened our doors in October, albeit for 2 months, and then we had to close it due to Omicron, but we've reopened as of this week. During that period, we saw about 450 people across Nuneaton and Bedworth, and there were people with complex needs, additional vulnerabilities, such as mental health or learning difficulties, or where English was a second language. What we've also picked up, though, is that whereas perhaps 3 years ago we were very much a face-to-face service, there is a proportion of clients now who are very comfortable in accessing our service and would prefer to access our service through phone and email. So the increased capacity is not only to meet the increased numbers, but the diversity of channels by which people will be accessing our services in the future.
Do we have any other questions? Councillor Downs.
Thanks, Chair. Not so much of a question, but a thank you. I talk to an awful lot of people on my ward, same as my colleague Damon Brown there. Thank you for being there for people. We we represent areas like Kersley and Exhall and Ash Green. And I know Kersley, through the pandemic, has been particularly hard with the finances and again with the mental health. And I've turned to you guys and you've been there every step of the way. So from myself, and I'm sure Damon, thank you very much for being there, guys, and may you continue. Thank you.
If we have no other questions, I'd like to thank you for coming along this evening. Moving on to the next item on the agenda, which is a work programme suggestion form. I take it that all members of the committee have read the suggestion. And what I was going to suggest was, if there was no objection, that we vote to put this into the work programme. Seconder there from Councillor Brown. So I'll take a vote on that. Are we all happy to put this into the work programme? Councillor Shepherd? That's carried. Moving on to the next item, I take it we've all had a look at the forward plan. I'm happy with that. And obviously we've all checked the work programme coming forward. So, moving on to item number 13, which is any other business. Just like to remind the committee that we have a briefing note from David Eltringham at the George Eliot Hospital. If any member has a question which they wish to submit, if you can email them to Rebecca by the 17th of February so we can get answers for the next committee. I'd like to thank you all for coming this evening. I'll bring the meeting to a close.